Welcome to our guide on 20 eye-catching thesis topics in clinical and general psychology. This presentation is designed to assist postgraduate students in selecting compelling research areas. Let's explore these topics in detail. Our first topic examines moral injury among healthcare workers post-COVID-19 in low-resource settings. It investigates the psychological impact on doctors and nurses making ethically distressing choices, particularly in LMICs like Pakistan. Key questions include predictors of moral injury and its relation to burnout and PTSD. Next, we explore childhood emotional neglect and adult attachment in collectivist cultures. This topic examines how early emotional deprivation affects adult intimacy, especially in South Asian contexts. It addresses the gap in Western attachment frameworks and their applicability to joint family dynamics. Gratitude, practices as culturally aligned adjuncts to depression treatment, is our third topic. It tests gratitude journaling as a low-cost intervention for mild depression, particularly in Muslim-majority societies. The research gap highlights the lack of empirical studies in religious LMICs. Emotional numbing in trauma survivors in disaster-prone and conflict zones is our fourth topic. It studies emotional shutdown in clients from traumatized regions like Pakistan and Bangladesh. The research gap focuses on distinguishing emotional numbing from PTSD avoidance. Our fifth topic explores therapist burnout and compassion fatigue in under-resourced mental health systems. It examines emotional exhaustion in therapists working in high-demand, low-support contexts, particularly in Pakistan. The research gap highlights the under-researched area of burnout in LMICs. Shame and guilt in substance use disorders in conservative societies is our sixth topic. It analyzes how these moral emotions affect relapse and recovery, with a focus on Pakistan. The research gap addresses the lack of culturally nuanced studies on moral emotions in SEUDs. Our seventh topic examines body image dissatisfaction and social media use among South Asian women. It explores the internalization of beauty ideals through platforms like Instagram and TikTok. The research gap highlights the underexplored body image issues in hijabi or modest dressing cultures. Religious coping and anxiety in faith-oriented cultures is our eighth topic. It studies how prayer and religious beliefs influence anxiety, particularly in LMICs. The research gap focuses on differentiating positive and negative religious coping locally. Our ninth topic assesses pornography use and psychological distress in culturally restrictive settings. It examines guilt, secrecy, and anxiety linked to porn use in conservative societies. The research gap highlights the lack of studies on guilt dynamics in Muslim-majority countries. Internet addiction and academic burnout in developing country universities is our 10th topic. It studies the impact of digital overuse on academic engagement, particularly in South Asia. The research gap addresses the lack of validated tools for internet addiction in local languages. Our 11th topic explores emotion regulation deficits in borderline features among urban youth. It examines emotional instability and impulsive behaviors with a focus on South Asia. The research gap highlights the underdiagnosis due to stigma around personality disorders. Non-suicidal self-injury among adolescents in high-pressure academic systems is our 12th topic. It analyzes the function and triggers of NSSI behaviors, particularly in Pakistan. The research gap focuses on understudied male self-injury and non-Western motives. Our 13th topic investigates cognitive distortions in social anxiety from a cultural perspective. It examines shame, fear of judgment, and humiliation-based thoughts, particularly in collectivist settings. The research gap highlights overlooked distortions in CBT. Thank you for joining us in exploring these thesis topics. If you need help in research or refining these topics, please write your message in the comments section. Don't forget to subscribe to our channel for more insightful content.